Good afternoon friends. I am Dr. Harshlata Ladda from Samarth Hospital, Aurangabad. Today we are going to talk about hysterolaparoscopy, that is keyhole surgery. It contains two parts like hysteroscopy and laparoscopy. These two entities are totally different, but when we are going for infertility management or for the diagnosis of the reason for infertility, in that case we have to combine these two procedures together. I will just explain you about the two entities separately, like hysteroscopy. What does it mean? Hysteroscopy means we have to put one camera along with the optics inside the uterine cavity, and we visualize the interior of the uterine cavity, lining of the uterine cavity, where the baby comes and gets implanted and grows. So we see whether that cavity is adequate or not. Is there any other pathology related for the infertility in that patient? Then another is laparoscopy. In laparoscopy, we put camera, light and optics in the abdominal cavity of the patient from the above, and we visualize uterus, both the tubes, then both ovaries, whether they are aligned together, whether they are in position or not, and along with that we see whether the tubes are open or not. We inject one sort of injection in the uterus and see whether the tubes are open or not. Then we see other pathologies like whether there is cyst or any other reason for infertility. So this is a daycare procedure. This is a daycare procedure. 1 day admission is required. Say morning patient comes, then afternoon we do the surgery, and by evening we discharge that patient. So stay is of 1 day, and it is less painful procedure and very safe, very authentic and very useful in infertility patients. So for this procedure, what are the indications, like in which patients we are supposed to do laparoscopy? When married life of the patient is more than 5 to 6 years and that patient is not conceived, in that case we have to see what is the pathology. Then if on ultrasound, if we find some sort of cyst in the ovary, or if we find some swelling or tumor on the uterus, that is called as myoma, if it is visible on ultrasound, that time also we have to go for laparoscopy. Sometimes we feel tubes are not open, sometimes we feel tubes are adherent, means they are connected to each other. Sometimes there is some uterine anomaly, like two uterus are present. In those cases also laparohysteroscopy is required. If there is some sort of septum in the uterus, means inside of the uterine cavity, in that case also we require resection of that septum. So then in case of abdominal tuberculosis, means tuberculosis is a disease, usually we think it is for the lungs, means patient is infected with lung tuberculosis, but there are different variants of tuberculosis. There is one abdominal tuberculosis. In that case also patient has difficulty in conceiving. So to diagnose that, we require laparoscopy, and this procedure is therapeutic as well as diagnostic. So in one sitting we can treat the problem. So that is really helpful to enhance the fertility. Duration required for this procedure is approximately minimum 45 minutes to maximum 2 hours, depending on the cause for that infertility. And it has to be done under general anesthesia, means complete anesthesia. And post-operatively also pain is very minimal. Patient can go home, she can resume her daily activities after 1 or 2 days rest. That is sufficient for the patient. So this is something about hysterolaparoscopy. In next video we will talk about IVF, ICSI, surrogacy, blastocyst culture. I will explain you in detail regarding those procedures in a short language, and we will meet soon.